Good morning. Today I'm here to present about onion peel appearance. So what is onion peel appearance? It is basically the appearance of radiograph which a specific pattern is seen in certain bone lesions. This is characterized by layers of periosteal new bone formation. These could resemble the concentric layers of onion. So next up we have radiographic features. In radiographic features, we have layered periosteal reaction, mixed radiopaque radiolucent lesion, and location. In layered periosteal reaction, we can see the onion peel appearance is in concentric layers. This can best be seen in CBCT or MRIs. In mixed radiopaque radiolucent lesions, you can see that there is a radiolucent part and a radiopaque part, which is dark and light areas. It is also best seen in radiographs, and the radiopaque region is due to new bone formation, and the central part of the lesion is radiolucent due to bone destruction. Location: it is commonly seen in long bones like femur, tibia, and in jaw bones it is mostly frequent in mandible than maxilla. And then clinical features, there is age and symptoms. Age, it is mostly observed in children and adolescents, and it can affect both females and males, but it may show slight predilection for one gender. Symptoms may include swelling, pain, tenderness in the affected area. Pain can range from mild to severe. Associated signs would be like systemic infections, fever, and etc. Differential diagnosis. There are 5 differential diagnoses along which this lesion can this radiographic lesion occur. First up is Ewing's sarcoma. Ewing's sarcoma is typically affected in children, young adults. It is aggressive when the soft tissue mass is included. Next up would be osteomyelitis, which is common in younger individuals. It is lamellated periosteal reaction with new bone formation. It responds to a chronic infection. Langerhans cell histiocytosis is the third one, which affects the children in young adults. It can be looked at like a punched out bone lesion, and periosteal reaction is also seen. Next is hypertrophic osteoarthropathy. It is associated with chronic condition. It often occurs in long bones. Fibrous dysplasia. Fibrous dysplasia in children and young adults. It gives a ground glass appearance with possible periosteal reaction. Imaging techniques: plain radiographs, CBCT, MRI, CT scans can be seen. Plain radiographs could be like they do not provide a detailed information on the extent of the lesion. So we use CBCTs. This provides a detailed and cross-sectional image of the bone structure. Next is MRI and CT. CT tells you about the extent of the lesion and high resolution image of the structure. And then there is case study. This case study is about a 15-year-old female who is presented with a complaint of swelling in the mandible with mild pain for past 2 months. So the patient has swelling on right side of her lower jaw, which she was reported as a mild intermittent pain that was not severe enough to seek immediate attention. There was no trauma, fever, or any other systemic symptom. On examination, extraorally, we saw that a diffuse swelling on right side of the mandible and non-tender on palpation. Intraoral examination, a bony hard swelling from mandibular right first molar to the angle of the mandible. But the overlying mucosa appeared normal. And then the radiographic examination, the lesion exhibited a characteristic onion peel appearance due to periosteal new bone formation. And then CBCT was done to provide a detailed view of the reaction. And the differential diagnosis was given as Ewing's sarcoma, osteomyelitis, and Langerhans cell histiocytosis. Diagnosis was done by biopsy. Biopsy was performed histopathologically, and then immunohistochemistry was done, which confirmed that it is Ewing's sarcoma. Along with the radiograph, in which the radiograph showed that onion peel appearance happened. So it was diagnosed as Ewing's sarcoma.